are the differences and why would you want to come to the Center for Manual Medicine for treatment of your musculoskeletal pain or suffering? When you're suffering, the pain is doing something to you. It's stopping you from getting to do what you want to do. And if you are suffering, you probably don't know how to change the pain. So the reason to come here is so you can quit suffering and get on with your life. And what we do is address multiple issues, one of which is physical therapy and the mechanics of the body. That can include joint movement, that can include how the muscles are balanced or whether they're activated or inactivated. That can include how the nerves are positioned or entrapped. Any number of things that we can address in terms of the mechanics of the spine and physical therapy can address and actually change. Most of the time, you're going to go to someone who is not experienced in musculoskeletal pain, and if they are, they're usually an orthopedic surgeon. So their toolbox consists of surgery and cortisone injections, whereas our toolbox consists of as many ways as we can come up with non-surgically to reduce pain and improve function and change the balance between the wear and tear getting out of balance with the repair process.
One of the things for physical therapy that we also take a look at is, as Dr. Fry mentioned, muscle imbalances, how things are inactive, but also breaking down certain regions of the body, the low back. A lot of times people with low back pain may have had prior chiropractic treatments, may have had prior physical therapy, which was unsuccessful. So they did not have the benefit of the team approach, the musculoskeletal team approach that we have here at the Center for Manual Medicine and Regenerative Orthopedics. A lot of times we could be making progress treating a condition where we hit a plateau. And a lot of times those plateaus can be stopping points to your healing. I can consult with Dr. Fry, who will, like he said, work with multiple different non-surgical techniques to help improve healing, nerve movement, ligament healing, joint healing, and allow us to further make progress. Communication directly is where the patient makes the most progress.
Well, one of the things we have is the fact that we're in the same building. And when Matt has a question about a patient, or I have a question for Matt about a patient, we just walk a few feet and talk to the person, talk to the patient, and we can all have a little meeting right there and a little huddle about what the problem is and solve it immediately, which doesn't happen anywhere else because we're a multidisciplinary practice where the physician and the physical therapist are working on site together.
Another benefit that we also have here is chiropractic. Dr. Danny Stephan is our chiropractor here and is well versed in many different techniques, soft tissue mobilizations and manipulations that we also can utilize as physical therapists, the specialists in moving joints. We can have open communication with her as she works the joints, gets things moving. She focuses on movement and postural imbalances as well as strengthening and bad habits.